Good afternoon. My name is Michael Bish. I'm the Executive Director of Yolo Food Bank, and I'm excited to be the moderator for this panel. I'm joined here by Catherine Brinkley, Associate Director, UC Davis Community and Regional Development, Jenniba Lahai, Executive Director, Yolo County Children's Alliance, Nolan Sullivan, Yolo County Health and Human Services Agency Branch Director. It's a long title, Nolan. And Ashley Brand, System Director, Community and Homeless Health, Common Spirit Health. So welcome all. Before we go any further, I do want to mention that I did watch this morning's panel discussion. Those guys really nailed it. They have set a really high bar, and so we have quite the hill to climb here. But I'm pretty sure you're all up to the task, and we'll save the day for us. So thank you so much for joining us. I'd like to go around first and give everybody an opportunity to introduce the organizations that they represent and talk a little bit, share a little bit about the work that your terrific organizations do in the community. So let's start off with you, Ashley.
Great, thank you so much. And thank you for having me. Really excited to be part of this panel and just part of this summit. Again, I'm Ashley Brand, System Director for Community and Homeless Health with Common Spirit Health. For those of you who are not familiar, Common Spirit Health was actually formed in 2019 with the alignment between Catholic Health Initiatives and Dignity Health. So you still see the Dignity Health everywhere in California, but across our system, we are known as Common Spirit. We actually have 137 hospitals and over 1,000 care sites across 21 states. So our footprint drastically increased when we merged from 3 states with Dignity Health to 21 states now. Historically, like Dignity Health, Common Spirit continues to have a mission and focus on really committed to building healthier communities, advocating for those who are poor and vulnerable, and innovating how and where healthcare happens. I have the privilege of leading our housing, insecurity, and homelessness strategy across the nation, with a primary focus in California, really looking at 2 areas around prevention, but also around integrating the continuum of care with healthcare when we talk about housing and homelessness. Over the last 18 months, we obviously had a quick shift in response to COVID, and the #1 need was around food across the state and actually across the nation, which no one's surprised about based on the data that has been provided. With that recognition, we also had an opportunity to see the value of creating a system-wide strategy around food systems, recognizing our local hospitals had been doing a lot of work, but there wasn't a system strategy where we had an opportunity to have shared visions, to learn best practices, but then also look internally from a supply chain, from investments, from health equity. And so we've been working over the last year to pull that together and create a system-wide food system strategy. And that's where my focus is, in addition to housing and homelessness. So really excited to be part of the conversation today, and pass it back to you, Michael.
Well, thank you, Ashley. Next up is Catherine.
I co-direct the Center for Regional Change at UC Davis. We're a research center, and we partner with nonprofits and local governments on research projects that center social equity. In doing so, the Center for Regional Change has been around for 15 years, and we work together on youth, housing and land use, and environmental justice policies. I'll pass it back to you, Michael.
Thank you, Catherine. I think you're up now, Jenniba.
Thank you, Michael. My name is Jenniba Lahai. I'm the Executive Director of the Yolo County Children's Alliance, and I am very excited and honored to be a part of this panel today with such wonderful experts in their own field. Thank you for inviting us to be a part of this, Michael. Yolo County Children's Alliance has been around since 2002. We were initially created to address child abuse prevention within the county. So we are Yolo County's Child Abuse Prevention Council. Out of that initial start, we decided to get into direct services. So when you really think about child abuse prevention, you have to think about programs to support families along with policy. So we got into direct services with our county-wide home visitation program, which currently serves over 100 families throughout the county. We have a family resource center in West Sacramento serving thousands of people yearly in West Sacramento and the surrounding area. as well as some specific programs like our CalFresh program, health insurance enrollment, retention. So anything you can think about to support families as they grow and strengthen and thrive, that's what Yolo County Children's Alliance does. Currently, we are dedicated in our homeless and housing program services with Project Room Key and Home Key, and of course, our partnership with the food bank in our outreach with CalFresh, as well as weekly food distributions. Thank you, Michael.
Thank you, Geneva. And Nolan, you're on.
Thank you very much, Michael. I'm really happy to be here today, and again, very honored to be on this panel with a bunch of my friends that are also working on food security efforts and eradicating poverty and all sorts of exciting projects. So this is kind of fun compared to the normal day job stuff. So my name is Nolan Sullivan. I work for Yolo County Health and Human Services. So it is one of the departments of Yolo County. We're what you call a super agency. So we have our mental health, our drug and alcohol, our child welfare, and our social services teams, as well as our public health functions, all rolled into one big agency. We're actually broken up into 4 separate branches in that agency. And I oversee the branch that basically delivers all of the social services programs or welfare programs and all of our employment programs. So specifically in relation to today's conversation, that's going to be Medi-Cal, that's CalFresh, that'd be our CalWorks program, foster care eligibility, and then we have a whole host of employment programs that we help folks get back to work on. I've been doing this job now for about 16 years, really dedicated to Yolo County, and I really love what I get to do every single day. I feel like I'm the luckiest guy on earth for the job that I have. We are currently serving about 65,000 residents in Yolo County out of about 220,000, which is pretty shocking. About 57,000 people in Yolo County, and that number is ticking up literally every single day. It's probably closer to 60,000 are using Medi-Cal as their primary health insurance, which is a bit shocking, especially in the middle of the pandemic. CalFresh is just under 20,000 recipients across the county, so 19,416 folks last time we pulled a census. That's probably closer to 20,000 now. And then CalWorks, or what a lot of people call welfare, there are 2,369 individuals, which is comprised of about 914 families. And so this is families that typically are really struggling to meet their basic needs, and in many cases maybe homeless, have all sorts of other issues kind of affiliated with that. So the way social services program funding sort of works is the federal government essentially sponsors these big programs at the federal level. They pass the money down to the state. The state then sort of decides how to deal with that. In California, the 58 counties operate their own social services program. So if you go to Sacramento County, you go to Solano County, it's a different program than Yolo County's program. The rules and regs are all the same, but each of the counties operates their programs independently. So we've got about 320 employees. We've got a pretty sizable budget. We're close to the 80 million mark, depending on what you count in the budget or out of budget with benefits and services. And we have 4 buildings. So we've got a building in Woodland, West Sacramento, Davis, and Winters. And again, we're serving a pretty significant chunk of the population. So really happy to talk about food security today and how we partner with our families and seniors to get them more resources.
Thank you for that, Nolan. Before I start facilitating the conversation, I do want to share a little bit about the food bank story with the audience. So Yolo Food Bank is the Feeding America affiliate for Yolo County. That's our service area. It's a pretty, the food bank model is a pretty cost-effective, efficient type model. What we're doing is we're primarily procuring food that's donated to us. So it's donated to us by farmers, by grocery stores, by food processors, large food distributors, and also by the USDA. And then we sometimes supplement that with additional food purchases from many sources. And then we redistribute that food. So the primary cost that we are bearing is in that redistribution cost. So it's logistics, the cost of logistics, as well as some programs costs to ensure that we can get that food to our most vulnerable community members, which is frankly quite a challenging task. And we'll probably dig into that a little bit deeper during this conversation that we're having here this afternoon. We're redistributing that food through 130 monthly distributions that we have around the county. as well as a home grocery delivery service that we have for vulnerable seniors and other homebound individuals. We have some kids farmers markets at some of the schools around the county. And then we also distribute food to many of our nonprofit partners, upwards of 80 or so around the county, including Geneva's organization, the Yolo County Children's Association. And so almost everything that we do here at the food bank is in partnership with other entities. They're either donors or funders. So speaking of funders, in a typical year when we're not in a pandemic, about 90% of our operational funding is through private philanthropy, and about 10% is through governmental sources. And then our workforce is supplemented with a huge volunteer source. So right now we have about 3,000 volunteers supporting the work that we do. That could be anything from repackaging food or sorting food to manning distributions and even doing some harvest activities. So it's pretty breathtaking what the work that all of these volunteers do, the community service from so many community members and local philanthropists. It's pretty awe-inspiring. So I want to talk a little bit about our nonprofit partners. I mentioned that there's about 80 or so of these nonprofit partners all around the county. So even very small little hamlets out in the countryside have churches and other nonprofit partners that are partnering with the Yolo Food Bank, and that way we're able to extend much deeper into the community than we could do by ourselves, because our nonprofit partners typically provide a whole bunch of services that we don't provide, so-called wraparound services, and they have community connections and relationships that are far more extensive than Yolo Food Bank has, since we're operating on a county-wide scale. And so I'm super pleased that everybody on this panel is a Yolo Food Bank partner. We've partnered on many projects. I would also say that there's upwards of 60 panelists and speakers participating over these 3 days, and almost all of them are partners in one way or another with Yolo Food Bank. And so it's really terrific to be here together with all of you and have an opportunity to highlight the work that we do together. And so I'd like to kick off the first of three questions that each of the panelists is going to weigh in on. So that's how we'll get this all started here. The first one is, I think we decided, Catherine, that you were going to go first, right? So whipping out our crystal balls now, if we had a truly resilient, equitable, and sustainable food system, how would life in Yolo County look differently than it does today?
This is such a wonderful question. So I want to preface my response by saying that we worked closely with Michael and with the Yolo Food Bank in the city of Davis when we were putting together a food system action plan. Earlier today, you heard from Valley Vision and the Sacramento Community Foundation about the regional food system action plan, and my research team helped support that effort. And one of the things that we did is review city and county plans. And these are collaborative documents that cities and counties put together with a lot of debate that crystallize shared values. And food security is not often mentioned on those agendas of shared values, even though there are state mandates to plan for agricultural land. And there are community values around community gardens, and there are state mandates to plan for environmental justice, and food justice and access are a big part of that. So I think, to answer your question, Michael, what it would look like is every city and every county across California, but especially in our region, has put forth a plan to feed everybody as a basic human right. And that plan is likely going to look different in San Francisco than it will in Davis, than it will in Woodland. And building those plans together is going to take, it's going to take county social services thinking creatively about basic income programs, which Nolan and Geneva are working on launching a pilot in Yolo. county right now. And it's also going to take nonprofits who fill the gap for folks who may not qualify for those social services. So there's a lot of exciting work to do, and now is the time.
I couldn't agree more, Catherine. Ashley, you want to tag on to that?
Yeah, of course. I mean, I think first off, if we truly had that, we probably wouldn't be here today. We wouldn't be having these types of summits. So, but I think to tag on to what Catherine alluded to is a shared vision, is truly everyone working together. And I don't think that's just for food systems. That's for the whole social, needs that we talk about, and the risk factors, is a true collaborative effort where everyone's coming to the table. We have individuals with lived experience being part of and leading that decision-making process, and kind of taking away that competitive need to put forth your goals and to come together and say, what is the solution from the community perspective? And everyone working towards that and being accountable, and checking in to make sure, if something happens, how do we respond collectively? I think when we get to that point where you have that trust, and I think there's pieces of that that exist, but I think back to Catherine's, that strategy and that document, how do we make that a living document and moving forward to action, but that everyone is working together? And I think to me, that's such a big piece of this work. Thank
you for that. Nolan has his hand up, so I guess that means he's next.
I didn't know if we're doing that or not, so I apologize, but I had something compelling that I wanted to share that, Michael, you and I have talked about many times, that I think is also very relevant, but sort of tangential to this topic. I think one of the things I've noticed is there is a set of assumptions out there by society at large, and there's a set of assumptions by policymakers that we assume that these agencies are there, that food stamps programs, school lunch programs, et cetera, provide enough to keep people's nutritional needs satisfied. We assume the food bank has these massive funders behind the scenes, or there's federal funding being pumped in, and no one will go hungry in our county, right? And so there's always sort of this assumption that there's this other mysterious agency down the street that's handling these needs that maybe we can't handle. And I think that assumption is completely false. And so I think in addition to having a plan and commitment and alignment, like Catherine and Ashley just mentioned, part of the issue is also educating folks. It's educating society, it's educating decision makers, that the reality on the ground is that there's empty plates tonight and that we don't have enough resources in the middle of this agricultural breadbasket, which is absolutely ridiculous to me sometimes, but there is a lot of scarcity. So in this land of abundance, the scarcity is certainly there. And I think part of our task, in addition to coming up with an aligned plan, is also educating everyone and giving them kind of a defined baseline to kind of operate from, because there is a lot of need out there. And I think there's a lot of assumption that needs being met or the resources are there. And in many cases, it's just not there.
So that's a good segue to Geneva. I mean, you get a close-up look at what that need looks like.
Yeah. So from a direct service perspective, I think that there needs to be some sort of destigmatization of accessing help. I believe that people of color, immigrants in general in this country have been discouraged from seeking assistance. Particularly, we had a really hard time prior to the pandemic and during the pandemic with public charge. Many of you know what public charge is. A lot of our clients are undocumented immigrants or are in the process of obtaining their documentation or are wanting to bring loved ones to the United States. So with public charge, that really derailed a lot of that destigmatization work and educational work that we did prior to the pandemic. And sometimes, if I had a crystal ball, I will go to every household in Yolo County and reassure them that assistance is there, the help is there, just access it. But what we find, especially with our language community, some of our Spanish-speaking community, is that, seeking help is taboo. You should pull yourself up by your bootstrap. It's that whole theory or whatever thought process that's being perpetrated throughout societies that, you don't go out looking for help. If you go out looking for help, then you are not a productive adult in society. So when the pandemic happened and the school shut down, that was really, it was really difficult for a lot of families, because if they're not seeking help at food distributions or going to the county to enroll in CalFresh, they are looking to the schools to provide food for their kids. So one thing that I really appreciate about Yolo County is the fact that a lot of our organizations, like Michael said, we all work together, we all know each other. So we were able to meet that moment. We were able to provide as much as we could to our community, either with home deliveries or weekly. We had a food distribution every day in particular cities. But again, as a society, we have to work on the destigmatization of accessing help, and just kind of, I compare it to a highlighter. I feel like a lot of the time, poverty is actually regarded as the biggest obstacle or a negative stance. That poverty is something that no one should experience, and that accessing help is a negative thing. So, as we're discussing this and as we're talking about putting plans into place, we also need to make sure that people feel comfortable in accessing those services.
Well, there's so much to unpack in what all of you have just said. Unfortunately, I'm the moderator, and I can't jump into that piece that you laid there, Jenna. But that's such a great point. This one about the destigmatization and this notion that somehow you have to earn the right to have your basic needs met. That is one of the greatest barriers to folks availing themselves of services and resources. And Nolan, I'm sure you could go on at length as to why that finds its way into so many governmental programs. But let's save that for the moment, and let's move on to this next question that I'm going to pose to Ashley. According to the Brookings Institute and other researchers, 1/3 of area households struggle to meet their basic needs. So 1/3 in the Sacramento region struggle to meet their basic needs. If we gave each of these households $400 to $500 per month in food assistance, besides increasing food security for that household, what other individual or societal gains might be achieved through that type of intervention?
I think there's starting to be a lot of research on basic income and really helping lift people up to a little bit higher income level. And I think when you talk about the $400 to $500 in food assistance specifically, it allows them not to have to choose what they're going to pay for each month. And when you talk about the stressors and the mental health attached to trying to figure out how to survive day to day, and taking that away, there's a sense of like, okay, I can do this. I can be present. I don't have to worry about, am I going to pay my rent? Am I going to get food on the table for my family? Is my utilities going to be cut off this month? There is that sense of, I can manage based on this additional income. And a lot of the basic income, results are showing that it does improve, mental health. It does improve their ability to follow up on appointments because they don't have to choose every single day what they're going to pay for. And I think the other thing to, when we talk about stigmas, and I know there's a question that popped up about stigmas, it's trusting the individual that they're going to make the right decision with basic income. I think the pushback is, well, they're going to choose not to pay what they need to. And that's not what the data shows. And so I think we need to, one, elevate how people are using the funds, believe that people are going to make the right choice. And that, yes, there's always going to be a very, very small percentage. It happens everywhere, but really elevate how people are using it and the impact that they're having on their individual health and well-being, their family, their contributions back to the community because they can give back. And then keeping the theme around stigmas, really elevating what they're choosing to do and making sure that self-choice is being the first and foremost impact responded to and elevated, because I don't think people realize the great choices that an individual make when they have these types of resources.
Oh, I think you teed that up perfectly for Catherine, Ashley. This whole notion of policy based on misconceptions or myth versus instead of grounding policy in data.
I actually think I'm going to probably lay this up for Nolan and Jennifer as well, because we're working with them to design an evaluation of a pilot study, and Yolo County will be the second county nationwide to roll out a basic income program. And there's a lot of power behind the county providing wraparound services, but also basic income as opposed to city level programs or nonprofit partner programs, just because the county is that go-to seat. So instead of talking about the evaluation piece, I will pass it directly over to Nolan and to Geneva to talk about the exciting program.
Yeah, I think all of the same things that Ashley was just talking about really resonate with my staff anecdotally. And so, we are constantly putting our most vulnerable folks in the situation to make really, really dangerous choices, right? Do you feed yourself tonight, or do you get your medication? Do you pay your rent, or do you pay your car payment? Do you pay for your health insurance, or do you pay for your childcare? And so what we're seeing is that families are constantly in the struggle, and the added stress that goes on with that struggle really just is a massive detriment to allowing people sort of the mental freedom and clarity to plan out the next steps in their lives. They're constantly in this sort of fight or flight, where am I going to sleep tonight? Where's my next meal coming from mode? And you never really have the opportunity to self-actualize. And so, we kind of came up with this fairly crazy idea. If we gave the lowest income families in Yolo County, and we know who they are, I have the data, I know exactly the 65 families that I want to focus on, and we actually gave them a living wage, pulled them above the California poverty measure for 2 years, what would happen to these families? And we theorized that really amazing things would happen to these families, because you're putting them in a position where they have the resources to not be in that fight or flight mode and actually map out the next steps in their life. And so we're really excited about this program. It's going to launch in January of 2022, I'm sorry. And we have 65 low-income families, each with one child at least under the age of 5. They can have multiple children. And we'll be supporting these families with a basic living wage stipend on top of their normal social services benefits to get them above the California poverty measure for 2 years. So hopefully they won't be put in those positions to make those choices, and we'll actually have some time to take a breather and figure out the next steps in their family's life. More importantly, we also realize that we're the government, and that we are not the most efficient at providing services that are super culturally relevant, and we oftentimes kind of miss the mark. And so that's kind of where I'm handing off the baton to Geneva, who has really been an awesome partner on this to help make sure that this isn't some, kind of government clumsy program, but this is actually effective, culturally sensitive, and actually works for the families, not just based on what the county thinks will work, but based on what the families think will work. So Geneva, I'll tap you into this conversation next if you want to jump in.
Thanks, Nolan. This is something that we've been waiting up for a while. As the Child Abuse Prevention Council of Yolo County, everything leads back to child abuse and neglect. Poverty leads to child abuse and neglect. Stress, just the well-being of families in general. Like Nolan has said, families are constantly having to negotiate what it is that they're able to pay for at the end of the month or mid-month. Should I pay for food? Should I fix my car? How am I going to get to work? Our region is not really, it's not really a transportation hub. We don't have a transportation system that's set up for people to utilize it consistently. So the families that we work with, they're constantly having to figure out, if my car breaks down, how am I going to pay for my car? Or do I need gas? One of the things that we did during the pandemic, we were able to find some funding to actually pay for gas cards for some of our families, especially our home visitation families. They're not comfortable taking a young child on a bus during a pandemic. They still have doctor's visit to go to. So we were able to provide them with gas cards. Something as basic as gas cards actually alleviated some of their stressors. So as a partner in this, we're looking at providing that peer-to-peer support. At Yolo County Children's Alliance, we created, I call it a pipeline to employment a while ago, many, many years ago. We are a subsidized CWAGS site, meaning that folks that are on CalWorks that are ready to work are getting job training. We bring them into our organization and we train them at the Family Resource Center to work in social services. After they're done with their training, whether it's 6 months to a year, and they are paid during that time, we then offer them an AmeriCorps position. So if they take the AmeriCorps position, after AmeriCorps, if an opening happens at our organization, then they become YCCA agency staff. So that's sort of the pipeline to employment we've created at Yolo County Children's Alliance. And the people who will be supporting the families going through this program were previous participants in the HHSA CalWorks program. Now they are full-time staff at Yolo County Children's Alliance. So those folks are going to be the peer support for the people that are going to be coming along. And from my perspective, I keep telling Catherine and her team and Nolan, let's make it as simple as possible. Being a single parent with 2 or 3 children, having to work, having to think about childcare, having to think about school, medical visits, everything is a lot for families. Families go through a lot. So we as an organization are there for peer-to-peer support and to keep it simple.
So a couple of you mentioned this notion of cash assistance, universal basic income. The data is already in on those programs, right? We already have a bunch of data from the Stockton program. We also have the census data that's been tracking the cash assistance programs that the federal government has instituted under the pandemic. It's shown how the efficacy of these programs, how impactful they are, how they drive down poverty, how they alleviate the mental stress and all these other stressors that these struggling families are impacted by. From a food banker's perspective, I was pleased to see that I want to say that the top use of this cash assistance was actually for food purchasing. Right. So it's not like, I can't remember which one of you mentioned that, one of the concerns by policymakers or some voters is that somehow this cash assistance will be misused. The data just doesn't support that. These recipients are responsible. They want to care for their family and for themselves. And so they're going to make the best use of this assistance. So there I am slipping out of my moderator role. I'm sorry for jumping up on my soapbox there. So the next question is, and I'm gonna ask this of Nolan. I'm gonna let you take first cut at this, Nolan. What has the pandemic revealed about our food system that we didn't know before, or perhaps weren't fully aware of? I mean, you were talking about the skyrocketing CalFresh enrollments. Is that some new thing?
I think it just uncovered sort of this hidden need, right? And I think in Yolo County, the two, I guess actually 3 areas that sort of keep me up at night would be senior food supports, really kind of that senior food network. We found out how fragile that network was, and we have some amazing partners in Yolo County that do some amazing things for our seniors, but a lot of it was based on congregate meal settings that really just were not COVID proof, right? And so the senior food insecurity system really took a big hit this year, and it sort of opened my eyes to really needing more support and more resources there. The second is the lowest income families. Just hands down in Yolo County, we have some super deep poverty, especially in West Sacramento and parts of Woodland, where families are constantly being put in that make your decision mode. Do I feed the kids tonight, or do I pay for the electrical bill? And I think that is more and more prevalent as the pandemic moves on. Not seeing the wage growth or the recovery in the lower income spectrum, especially of families, really kind of bouncing back to where they need to bounce back. And we're seeing more and more reliance on government assistance programs, in addition to services like the food bank, Section 8, all those different things. Those numbers are off the charts. I mean, they continue to grow and they keep kind of skyrocketing. The last piece, and the piece that's sort of unique for Yolo County, is college students. So there's a massive surge in applications right now. We have as of this morning, I'm pulling up the numbers right now, we're somewhere in the ballpark of 3,800 applications right now. Normally we're actually under 800. And so we have a massive surge in applications right now, driven mostly by students and folks that are coming off unemployment. So many unemployment changes ended from the federal government in early September. And so we're seeing a massive surge in food stamp applications. And so what that tells me is a couple different things. First, that we have an underemployed population, a population of folks that maybe are working that just can't make ends meet. You know, the high housing costs in California, we rank dead last in affordable housing out of all 50 states in California. People just can't keep up. And so when you're looking for a little pressure, a little relief, you can't just pay your landlord less. You can't pay PG&E half the rent. You can't pay the water. It's going to be food. And so food is one of the easiest ways to sort of implement and kind of reinforce and shore up people's kind of immediate safety net. And we're seeing that dramatically right now with college students, senior citizens, and vulnerable families. And honestly, it's not slowing down. That's one of the things that really worries me. Looking at the numbers of applications for CalFresh, and then also looking at the numbers of poundage that the food bank's releasing. And Michael, I'm not sure if you had earlier presenters talk about this or if you'll talk about it, but just the sheer escalation in the millions of pounds that the food bank's distributing in conjunction with the CalFresh applications, the canary's dead in the mine shaft. Like, something is happening in our community, and we need to figure out exactly what's happening and triage it. And it is all surrounding kind of food in one way, shape, or form. In addition, medical care. This is the largest Medi-Cal caseload we've ever had in the history of Yolo County. You know, again, we're in a pandemic, so it sort of makes sense, but it just shows you the average Yolo County family or individual cannot make their basic needs, and we have to do something about it.
So I'm going to change things up a little bit here on the fly based on that comment that you just made, Nolan. The economic data is showing that everything's getting better, right? The unemployment rate's going down. I just heard from at the State of the County speech last week that the unemployment rate here in Yolo County is below the state average, for example. You know, the stock market's going crazy. Economic activity is still increasing in a rebound. But what I'm hearing is none of us is experiencing that as service providers. It seems like there's this massive disconnect. How can the need be still so high and we can see the need, and yet some of this data, some of this economic data is painting a contrary picture.
To give a little background there, so we started out in January of 2020, pre-pandemic, right, at a 4% unemployment rate. And so that was kind of where we were at before COVID. We peaked in April of 2020 at 11.9%, which is pretty massive, right? It's a pretty dramatic increase. And it has dropped all the way back down. So we're actually back down to 5.6% now in August of 2021. So we're really not too far off from that January number. The good news is we're consistently about 2% below the state average. So the state is doing a little worse than Yolo County in totality. But I think what this really is, and what you're getting to, is really this uneven recovery period, right? So folks typically that had a college degree or higher experience far less bouts of unemployment, far shorter periods of unemployment compared to some of our peers that had a high school diploma or less. Oftentimes, if you look at this by racial classes or different demographic groups, you're seeing that typically folks that are in more diverse categories experienced a deeper kind of recession and deeper pain than others. And honestly, I think what has sort of happened and what we're seeing is you're seeing a lot of industries right now that are really struggling to hire. And I'm not trying to place blame on employers, but a lot of these employers are low wage to minimum wage, no benefit, high exposure to COVID, high workers' comp issues. And honestly, folks don't want those jobs right now. A, you can't pay your bills, you can't pay your rent, you can't get by on it. And B, it exposes you dramatically to the pandemic. And so I think what we're seeing is a very uneven recovery. And what's happening is people are using resources like your resources, my resources, Geneva's and Ashley's, to really kind of shore up and kind of hodgepodge their family safety net and kind of get by. And so again, that recovery is very uneven. So even though unemployment's back down, underemployment is a massive, massive issue right now. You mix underemployment with inflation, it's all bad, right? So when the cost of toilet paper and beef and milk goes up and wages are stagnant or under, then we're in big trouble. And I think that's kind of what we're seeing nationally, and we're seeing that regionally for sure.
Thank you for that, Nolan. Catherine, I want to give you an opportunity to circle back to the base question. What has the pandemic revealed about our food system that we didn't know before or perhaps weren't fully aware of?
Yeah, I'm to piggyback on the conversation that you were having before. The food bank and the county services serve folks with basic needs, human rights, housing, and food, the very most basic. And those folks are often also the essential workers. So the pandemic revealed how reliant we are on low-wage workers and also how vulnerable those low-wage workers are. So as we're seeing statewide policies and even very conservative states like anti-eviction policies evaporate as the country has decided it's done with COVID. Those folks who were relying on that housing component are now turning more towards social services and nonprofits like the food bank to fill that gap. And I think the pandemic, if anything, helped everybody realize the vulnerability of pretty centralized supply lines that are dependent on low-wage workers and immigration policies as well, which I know is going to get to some of your questions later on around local and regional efforts versus global and national efforts. But the pandemic really highlighted who's living on the margins and who's helping folks shore up above those margins. So now we're getting to a point where we're talking about deservedness, which I think gets back to this basic income program where, Michael, as you're saying, the verdict is in. There've been plenty of pilots that have shown that people spend basic income program funding on basic needs that are totally understandable. And then you have the team that we've built at UC Davis has economists who are asking, does this cost less than social services long term? There is data to indicate that yes, it will cost less. And then we have child health experts who are weighing in on, and will this create healthier adolescents, healthier adults who can better participate? There's data to indicate that yes, we will move in that direction as well. But I think the basic question that comes down is a very political one of who's deserving of basic services and basic human rights.
Yeah, who is deserving of basic human rights? It seems pretty self-evident, right? Everybody. Janaba, what has the pandemic revealed? What are you seeing on a daily basis about what the pandemic has revealed about our food system?
So we operate 3 different food distribution sites in West Sacramento, 1 in Clarksburg. We have 2 in West Sac, 1 in Clarksburg. And our weekly one at the Family Resource Center, we went from seeing maybe an average of 150 families pre-pandemic to over 250. And this is all drive-through, as well as we have opportunities for folks that don't have a vehicle. To me, what is revealed is the need and the emphasis that everyone deserves food. Again, it goes back to the basic human rights. Everyone deserves food, shelter, and health. I mean, everything that we all need to be productive adults and to be well and safe, everyone deserves that. Another thing that we haven't talked about during this panel is childcare. So what I've noticed on my end, just working with our programs in general, we've had some of our caregivers, especially the women, they had to leave their jobs. Some of our moms were also part of the essential workforce, and they had to leave to take care of children at home. So when you're losing another income, because we have, sometimes we have 2-income families. When you are losing another income, then you have to supplement. And like Nolan said earlier, the easiest thing for families to supplement with is food. So I find that some of our families will go to our food distribution, go to another food distribution down the street, on another day, go to another city. We've had families from West Sacramento going to Clarksburg for food distribution. Families are just going all over the place right now, trying to supplement what they can. So to me, the pandemic, we already had inequality in just income inequality in general. Everything leads back to poverty for me. We've had inequality with income prior to the pandemic, but what has happened is that it's just being exacerbated. It's just people who were poor, living on the margin, cannot afford housing. Even housing has gone up during the pandemic. Rents have gone up. There's nowhere to put people. There's no affordable housing available. So all of that has been really alarming for us working in the social services field, trying to manage, trying to encourage families to continue to persevere during this time. We have a program called the CMERS Family Stabilization Program, which is mostly working with families, intensive case management with families that have children attending Washington Unified School District and trying to help them to maintain their housing. It's all about housing stability and also looking at different ways where they're able to increase their income. And that program has basically highlighted that they're in a tough spot. I don't know what the American saying is. I think it's called between the rock and the hard place. They're in a tough spot. How can you assist someone in budgeting when they don't have anything to budget? That's what we've been reporting to our funders, that they can't. It's just impossible. Sometimes we put people in impossible situations. And it can be quite frustrating and demoralizing at times.
It's a great response. Ashley, what are your thoughts on this question?
Yeah, I mean, obviously everyone has said so much. I think the one thing to add on with Nolan was the aging population and the recognition that if they couldn't get out, food was not getting to them. And I think we had to respond quickly. But it was interesting being focused on housing and homelessness. That was one of the quickest things to respond. We had pop-up shelters. We were, obviously Project Room came down the road, but the food came after. I was working with a project in LA and they had pop-up shelters ready, but they didn't have individualized meals that were ready to go. So we provided a donation to get those meals, which allowed them to open up 2 weeks earlier than when, the local government could provide that. And it was just trying to move money around. It was no one's fault, but it was interesting to see the shelter piece flip quickly, but the food not to respond as quick. The other partnership we developed was with AARP, where they were actually delivering boxes of non-perishable food to people 55 and older, because again, they weren't getting out. And that wasn't supplementing all of the produce and necessary fresh food, but it was something to make sure that, if they had fear of going out, and especially in the rural communities, at least things were getting delivered to them. But it took a lot from what we were hearing from our partners of trying to figure out that delivery opportunity. We helped purchase some food delivery trucks in Northern California, just again, trying to get the food out. And they were saying that their deliveries, went from, I think it was, 150 a week to 500 a week. And they were just constantly circulating, trying to get it out. So I think what it showed is we weren't ready for any type of crisis and our system wasn't equipped to respond quickly. And I think one of the things we're trying to figure out now is how do we support our community partners? What is that type of partnership we need to make that resiliency really the front and focused effort so that we're prepared if something happens again? And unfortunately, it's likely to happen again. And so what are the lessons learned from here that we can move forward around the food piece? Just because, again, I think Nolan, you articulated, it's not going anywhere anytime soon. And we've had to shift the way we approach. I mean, the food distribution was completely turned upside down, all about individually prepared meals, getting them out. But from a health system, I think what we, really relied on is listening to our community partners and helping to respond quickly based on the needs that they were seeing in their own communities. And that looked different across the nation. It looked different in the approach of rural versus urban, but the needs continue to be the same.
This idea that these these elevated needs, pandemic-induced needs, and as we touched upon earlier, to quite an extent, they're not even pandemic-induced. It's just the pandemic revealed the previously hidden unmet need. And yet I'm hearing from policy, from electeds and policymakers, this anticipation that all of this is going to dramatically subside sometime in the next year or so. If we took a straw vote right now with your hands up or hands down, how many of you are expecting this to subside anytime in the near or even medium future? None of us, right? This is going to be ongoing.
Income inequality has only grown over the last 3 decades. So it would take quite a lot to reverse the current trends.
So I actually have a question teed up for you, Catherine, on that point. But first, I want to take this question that's in the chat. What are some low-hanging fruit in policy and programs that could be enacted to reduce poverty and suffering among our region's communities? Geneva.
I forgot to unmute, of course. Oh gosh, I think we need to really access some of the less formal, systems, shall we say. I know Nolan mentioned earlier that they are the government, so they rely heavily on their nonprofit partners to help facilitate some of their programs, as well as, interact with the community. So from my perspective, I'm looking at, at our organization in particular with our Family Resource Center, we take care of West Sacramento. We see West Sacramento as our hub of operation. So I'm looking at some of the less formalized systems in West Sacramento, the community groups. I think one of the policies, something that policymakers really need to take a look at is meeting the people. We talk about meeting families where they are, but meet the people where they are. Ashley was talking about people with lived experience, bringing people with lived experience into the fold, learning from them. The African-American community is completely different from the Spanish-speaking community, from the Russian-speaking community. And now we have a large Farsi speaking community in Yolo County. Meet the people where they are. Talk to the community members, figure out what it is that we can do as leaders within this community to meet their need. What is their immediate need? Another policy thing that we could do as service provider, and I think Yolo County does a really good job of this. I'm always hearing from colleagues in Sacramento County about how well we all work together, is to continue the conversation. Having this summit is amazing, having this opportunity for us to come together and share ideas and share thoughts, continue our advocacy work, continue our collaboration, and again, include people, bring in those less formalized systems, bring in those community groups. Let's meet the community where they are.
That sounds good. I just real quick, I already heard a couple of suggestions on low-hanging fruit. So one was the universal basic income program. That seems like a pretty straightforward piece of low-hanging fruit that's been proven to be super effective. I've also heard reducing some of the loosening up the qualifications for the programs. I heard that from Nolan earlier, although a lot of those programs are state and federal programs, so I'm not sure how feasible that is. I don't know if any of you caught the Valley Vision presentation of their new food action plan. Yeah, that's it, food action plan. But they mentioned an action that's low-hanging fruit, which is full implementation of the SB 1383 edible food recovery program. That seems like low-hanging fruit. And Nolan, you have your hand up here, so it looks like you have some ideas too.
Well, a couple add-ons, and I kind of wanted to add on to your comment as well as Geneva's comment too. I think the term low-hanging fruit is subjective, right? So in a lot of cases, if it was really low-hanging, we would have done it by now. But yeah, I mean, one of the challenges, especially with government services, is most of our programs have federal rules and regulations, and so they are driven at the federal level. And I know we had Congressman Garamendi on here earlier. It's just so hard to connect kind of his work to the ground level sometimes, and I think get those programmatic changes that are really far in the weeds that really make big impacts on the ground. But a couple like rules of thumb that I've seen in Yolo County, I do feel like Yolo County is sort of a pioneer when it comes to providing services in other counties. I really wanted to add on to Geneva's comment about partnerships. I think partnerships are extremely important, and Yolo County, in my opinion, does an excellent job partnering for a variety of causes. So homelessness, for example, you have an amazing homeless policy action committee, HPAC group, with all of the providers sort of working together to try and kind of combat the issue at the provider level. You have an executive commission on homelessness. It's one elected from every city. It's an elected from the county. It's all of the staff working together as policymakers, decision makers, funders to really address homelessness across the spectrum. I think coalescing those groups, right? Coalescing even Geneva's organization, they were kind of combined and created to sort of coalesce around child abuse, right? So I think one of the lowest pieces of hanging fruit for any topic is to create a local work group with people that are committed, that have the ability to make change and sort of make a difference. And I think in the food space in Yolo County, we've had some really amazing efforts, but it's kind of stumbled a little bit. And so maybe that's an area to kind of at least start the conversation. Again, folks from the senior space, folks from the student space, folks from the family space. I do think that like HPAC or like the Executive Commission or like some of the other groups we have in the county, that is something that should be sort of talked about. I think the next piece is kind of the point that you just made. The state government knows who the lowest or the lowest income, most impacted homeless families are. The state government knows who the most vulnerable seniors are. And oftentimes it's a really small chunk of the overall population. So again, I think intensive programs that are provided to folks that give them the resources to get out of poverty and have the minimum amount of strings possible usually is the best approach. And I'm really glad the state of California is starting to move towards that. And you're seeing now with the Mayors for Basic Income, you're seeing all these other programs across the state of California and the nation where governments are sort of realizing, hey, we know who our hardest hit community members are. Why don't we start applying some intensive resources? And I think that is the area that is the most effective. If you can have a city, a county, nonprofits, and the state working together on those programs, it's a home run. And so I am kind of excited to see what happens with those in the future. Medium and high hanging fruit is really changing those program regulations at the federal level to kind of make sense at the local level. But that, is a tougher ball game than I think today's conversation will get into.
Yeah, we will definitely have to save that and some gray hairs for that conversation. Catherine, you have your hand up.
I just want to take an opportunity to talk about one of my favorite research subjects, which is street food vending, because the pandemic has forced a lot of folks into informal employment, and street food vending is a policy that would be very easy for cities and counties to just strike. The pandemic proved that cities and counties could move very quickly in allowing outdoor vending, and a state Senate bill 946 passed in 2018 said that street food vending regulations cannot be applied at the city or county level for reasons beyond public health. However, when we reviewed city and county street food vending regulations, 85% of cities had additional regulations around labor, like requiring street food vendors to get fingerprinted and have criminal background checks. So there's some pieces there that would allow lower cost food and decriminalize a pretty common practice that would be easy to implement. The reason, to Nolan's point, if it were low hanging fruit, why isn't it happening? I think it's because sometimes local jurisdictions tend to criminalize just being poor. And that is what's happening with street food vending. And then to your point, Michael, just for audience members who might not know about 1383 Senate bill on food waste recovery, that would be a wonderful way to get grocery stores and restaurants to not only reduce greenhouse gas emissions from food that would be wasted, but to link those food sources with food banks to feed people. So there's a lot of opportunity and I think a lot of hope around that as well.
Yeah, I think so too. Ashley.
Yeah, I just want to tag on to a few things that Nolan was saying. I think, you bring the multiple sectors together, but it's that coordination and it's making sure there's a seamless pathway for an individual or family to get the resources and not have 5 different stops that they have to go to. I think the one thing that we've talked a lot about from a healthcare perspective is the linkage between Medi-Cal and CalFresh. Like, how can that be one application? How can we make sure that people can have an easy way to process to get all of the benefits that they might be eligible for in one application without having, multiple locations to go to, multiple verifications. And I think when we, it's not a perfect system, but if we get to that point where we're actually creating or reducing barriers to resources and then making sure those resources can be accessed is something that I know we've talked a lot about from a healthcare perspective, but with a policy framework tied to it.
We have another question in the chat, but before we take that one on, I want to circle back to an issue that Catherine raised. This notion that, the pandemic has shown that there's certain workers, and it's a large number of workers, that are absolutely essential to the daily life of every single community member. I mean, that's why they're called essential workers, right? Whether you're privileged or not so privileged, you require these services, grocery store clerks, ag workers, there's a whole slew of them. And they were the ones that showed up for work every day throughout the pandemic. And yet these, what'd you say, Catherine? These are some of our most vulnerable community members. That seems like a disconnect. If they're so essential, you would think the value of their labor would garner a higher market rate. Well, how do you account for the fact that, how do you account for that disconnect? It makes no sense.
It doesn't, but I mean, I think this is a national level conversation about living wages and a cultural national conversation about deservedness. But it played out in so many ways where you saw, meat supply lines crumble because folks were crammed into packing plants. And when supply lines are centralized like that, there's one vulnerable location where lots of essential workers are needed. And if everyone gets sick, it messes up supply lines nationally, which from a network perspective, creating more regional resiliency seems to have worked for regional grocers. A lot of those same grocers have a different approach to how they pay their employees and support them. And they're also very embedded in their local communities. So I think thinking locally about taking care of each other is an important takeaway from this while we wait for the national conversation to work itself out, which it's been working itself out for hundreds of years. So, in the meantime, there are things we can do city and county level to really acknowledge and support the folks who are essential.
Yeah, perhaps there's ways to, well, not perhaps, there are ways at the local level to support these essential workers through non-cash means. So definitely, if you give somebody $400 or $500 worth of groceries, through every week, that's almost the same as cash. That's like raising their wages, and I'm sure there's other means to provide this type of assistance as well, non-cash assistance. So let's take on this other question in the chat here, and this was, I think, I want to say Geneva also mentioned this at the outset regarding stigmas on accessing help. What are some strategies that can be enacted to reduce stigma? And yeah, that's a super relevant question. That's one of the primary barriers preventing folks from meeting their nutritional needs that we've identified at the food bank is this notion of stigma, either real or perceived, around that. So Geneva, I think you have some anecdotes around that.
What we've done in my organization is hire directly from the community, particularly the Family Resource Center. So I talked about how we created a pipeline to employment. Most of the staff who are from the Family Resource Center have accessed public programs in the past, so they know what our families are going through personally. I call them more of a peer support staff. So we not only hire directly from the community that we're serving, we also hire from particular cultures. We have our people, our staff from Afghanistan serving the Afghanistan community, the Farsi speaking community. We have staff from either Ukraine or Russia serving our Russian speaking community. That's how we've been able to really address some of the stigma. Because I'm an immigrant myself, I'm West African, and although I've lived longer in the United States than in Africa, when you see your community represented, another thing that's really important is that representation matters. So when you see your community represented in a certain space, you feel more comfortable. You feel that the stigma no longer applies to you because you have your community members accessing services at that site. One thing that I heard, we conducted a focus group recently for our housing program, especially with our African-American families. We wanted to hear more about what they were experiencing as it relates to affordable housing and just homelessness in general. One of the participants stated that, they would like to see representation in positions of power in Yolo County. Meaning that policymakers, decision makers, they want to see that space opened up so that, women are some policymaker, people of color are also policymaker. I think if we continue to be more inclusive in that regard, where representation is highlighted in everything that we do programmatically as well as policy-wise, then people will start to feel more comfortable and that stigma may be reduced.
Thank you for sharing those insights. I think you've previously mentioned to me, Geneva, that one of the ways that your organization has been working to reduce stigma is by building relationships with individual community members, so that they're not seeking help from strangers. Rather, these are from trusted service providers. Perhaps you can comment a little bit on that.
Yes. Another program that we started in our organization is we call it the Championship or Ally program. So when we have opportunities to do outreach, we tend to incorporate community members as allies or champions, and we pay them for their services. That's another thing too. I feel like in some regards, we're constantly asking people who are already in poverty, who are experiencing income inequality, to do things, to provide feedback, to help us reach their community, but we don't value their services. I think that kind of correlates to essential workers. We realize that there are a group of people in our community who are essential workers. If they don't perform the jobs that they are performing, our societies cannot operate. But we don't value the skill set that they bring to the table. We don't pay them as equally as we'll pay an engineer or someone who is behind a desk every day. So that's another thing that we've done. We've created these community allies within our immediate community where we're incorporating them into the work that we do, which is creating more of a community. We try to build community. We're bringing in these less informal settings into the Family Resource Center, and they're able to really reach the people who are very distrustful of the whole entire process, especially our undocumented families.
Thank you. Nolan and then Ashley, you both have your hands up. Go ahead, Nolan.
I couldn't agree more with Jen at this point. So pretty much on each one. And the county has slowly but surely sort of discovered that we are not the best to do outreach. We're not the best to really engage with communities. And so finding community partners like Geneva and YCCA, or groups like the Promotoras, or other groups, Rise Incorporated, for example, that are really embedded in the community and sort of represent the community, provide a great bridge, I think, in services. It kind of the big scary government, right? It's a way to have kind of a soft approach to kind of work with that. I think the other area that I don't, because Jennifer covered that really well, that I wanted to pivot to slightly was in kind of a different context, especially with college students. We found that a lot of it's about branding, right? It's about how you talk about it. So if we go to a group of students and say, hey, do you want to apply for welfare? Like they're not, it's not, there's a stigma associated, it's taboo, it's looked down upon. And so all of our efforts right at the beginning were us kind of flyering and talking about CalFresh and food stamps and going to the food pantry on campus and, going through the UC Basic Needs Center. And we really just weren't getting a lot of traction. Folks were kind of leery. They didn't want to complete the application. No, that's for other folks. I don't need it. Someone else will go without. So dispelling some of those myths and rumors. And we slowly discovered that if we partnered with the financial aid office, so the financial aid office, they started sending out our advertisements with FAFSA requests and student grant requests. And we started talking about it more like a student financial aid opportunity, the financial aid for food kind of thing, that the applications absolutely skyrocketed. So sometimes I think there is a stigma just associated with our programs, and folks often feel guilty or feel like if they take this program, someone else can't have that program. And so it's sort of the way that you approach it and you sell it and you package it to your consumers as well. We want full participation in all of our programs. And so, again, it's sort of the way that you talk about it. And so that college student experience can be applied to the undocumented community, can be applied to seniors, can be applied to all these different scenarios. So I think there has to be some intentionality about how you deliver that traditional message and who you maybe engage with as a partner to deliver that message for you to really increase the effectiveness.
Thank you. Ashley.
Yeah, I think to add on both of those, but to add another partner is the faith-based community. That's something that we really saw, especially in the pandemic, when there was concern of getting food out, just giving boxes to different churches and letting them do what they needed to do within their congregation. And I think when you talk about that trusted entity, again, trusting them that they're going to know the right population, who to reach out to, how to reach out. Nolan, to your point, what the message should be. I think we found a lot of opportunities and partnerships there where they said, just here's what we need. And we said, here you go, and they just did wonders. And I think it just kind of elaborates on that collaborative approach with the community partners, with faith-based. Across the gamut, it goes back. And I think we started the conversation with this, trusting the community that they know best, listening to them and helping them. I think a lot of times to Jen, about what you talked about was, we ask a lot of them and sometimes we don't respond, which is like the worst thing. It's like, what do you guys need? And then we're like, okay, thank you. We'll keep asking someone else. I think COVID taught us that if we're going to ask, we better respond and better respond quickly and not put a lot of barriers in trying to access resources. So for us, it does change the way we partner and are intentionally reaching out to partners that we haven't historically partnered with, but also recognizing that they're not going to be able to complete a 5-page or 10-page application. They're not going to be able to, provide an evaluation of 50 pages of all the metrics we want. We just had to respond and listen and trust that they were going to know what to do in their own community.
Great response. Catherine, you have your hand up as well.
Well, I just want to draw attention to some research that PhD student Alana Stein did with Yolo Food Bank around stigma and drop-off distribution locations. And one of the findings she had, I think, has been really well operationalized, particularly on campus at UC Davis, where instead of having a main entrance to the pantry, it's people can't easily see when you're going in and out, which helps a little bit, but that's more hiding it. What Alana discovered was that because there's so many organic partners who donate food to the food bank and fresh fruits and vegetables, and partners who they have labeled boxes and label their food, that recipients felt like they were getting really high quality food and they felt really good about it. And that helped destigmatize it a lot as well. So that branding, marketing, and celebrating of the partnerships, I think, is important to letting everybody know that they deserve a healthy diet. And then I know too, the food bank has done a lot of partnerships with fridges around town where food is just there and you don't have to necessarily go at a certain time to a pickup location. So that those access points and the design of that access point has been important.
Yep. I want to. So I have a little bit of a different thought here. This notion of stigma. In my experience, the intensity of the stigma varies based on the service that's being provided. So while we've been talking about, stigma associated with free food distributions, there's this interesting dynamic that goes on with food. So I have a question here teed up for Geneva. It's social service providers frequently refer to free food distributions as a gateway to providing other services, an icebreaker, so to speak. How does that work and why?
I think it's a cultural thing. For many cultures, social needs are met around food. When you go to someone's home, the thing that they serve you first is either water or some snack. I'm speaking particularly for my culture and some of our immigrants that come over to the United States. Everything is surrounding food. That's just how it is. So when you are wanting to introduce people or families to services in general, we try to lead with food. I mean, everyone needs food. Food insecurity is real within our community. And having something that is valuable for people, something tangible that they can take home and say, hey, look at what I got today. I went to this place, the people were really nice. I met someone else that spoke my language, and I was able to come home with this stuff that I can prepare for the family, has been invaluable. Michael, you're aware, every time we have an event, back to school health fair, toy distribution, anything that we have in West Sacramento where we see close to 1,000 families participating in these events, we always lead with food because we want to make sure that it's worth their time and that they have something tangible to take home, which also starts the conversation about services in general, like how were you treated? Oh, they provide this as well. Oh, do you need utility assistance? Do you need eviction prevention? It also starts those services. And another thing that we do is that when people are coming to events, we always have a registration card. We call it a passport, where it becomes a fun game. It's not just, we're not really picking people out. It's just a game. Everyone gets a passport or a registration card, and everyone gets to go around, whether you are accessing services or not accessing services. Everyone gets to go around and visit all the different resources that could be really valuable for their household. So again, food is a gateway in our community, especially with a community of colors and immigrant. Food is a gateway. It really does start conversations.
Thank you for that. I can share with the audience that over the last 6 months, both the county and YCCA and a number of other nonprofits have been using the free food distributions as a means to penetrate a little bit deeper into the community, into the vaccine hesitant, the COVID-19 vaccine hesitant community, in order to get more people to avail themselves of the vaccine. So there's been a number of pop-up vaccines that have been centered around the food distribution. So the food is definitely a gateway in that regard, and for many other services, as far as I know. There's another area that I want to get into that we haven't touched upon yet, and it's for this is a question I have teed up for Ashley. So medically tailored meals and food prescriptions are terms we are hearing more and more about. What can you tell us about these healthcare strategies and how they are evolving? What's the role that food and nutrition is playing in these programs?
Well, thanks for that question. I think we know the linkage between nutrition and an individual's health as it links to chronic illness. And when we talk about food insecurities, the linkage to, mental health and the stressors that are added to it. Medically tailored meal and food prescriptions have been around for a long time. They're not new. I think they're just getting more visibility. There's been a lot of work with the California Food is Medicine Coalition. They actually published a brief in August of this past year highlighting the importance of medically tailored meals as food insecurity and health and equities continue to rise. I think the other thing that we're seeing, the reason why there's getting so much visibility is the tie with CalAIM, especially around California, and the ability that some of these things could be reimbursed by the plans or the payers. So when you look at medically tailored meals and just very high level, it really is meals targeted for certain populations based on a physician identifying either a risk factor, a social factor, and then creating those medically tailored meals that are delivered to the individual. I think when we talk about that, we also want to be very mindful of the cultural component. You can't just give someone a food that they're not used to and expect them to understand how to use it or eat it or feel comfortable with it. And the other piece that's tied to that is the nutritional component. Usually, oftentimes with medically tailored meals, there's registered dietitians that are connecting with the individuals really to make sure they understand what they're eating, how to eat it, why it's important in response to whatever chronic illness that they're working on. The challenge is a lot of these programs are, 6 weeks to 12 weeks. And if we don't have that long-term sustainability or we're not increasing access to healthy food, it's a limited response. But I think, again, as we start looking at CalAIM, and there's still a lot of unknowns around CalAIM, what the reimbursement is going to be, what the cost is going to be, how that supports local farmers is going to be a key component of as we look at medically tailored meals. But I think it's a recognition that there's a clear linkage, and not that we need more research to show that, but that if people can help get access to nutritional meals, they can address their health needs. The food prescription, I think, has been a little bit more prominent, where it's more of here's a box of food, and that can be where there's a prescription to a local farmer's market. There might be community health workers that are identifying social needs and risk factors that then they can bring a box of food to the individuals. I don't think that's, it's not as medically tailored to a specific chronic illness. It's more of a social risk factor that they're identified as needing access to food. But that, I think, is a better opportunity to connect with like locals, farmers markets, and some of these other programs that we've seen historically across the nation being really well received. There's a lot of physicians that say, all I want to do is be able to write a prescription to nutritious foods. But again, if we look at nutrition insecurities across these regions, you can't just write a prescription and expect the person to find the food. It has to be attached to some type of, here's where you go, the food will be ready for you. And I think the biggest piece is making sure people know how to consume it. And if they don't, how do we make it culturally appropriate? Because if you tell a certain community, you can't eat this food, and that's part of their every single daily component, it's how you make it, what type of portions, are appropriate versus just pulling that food out and saying that's not healthy. Because I think you're going to lose the audience in that. But those programs are very well known. I think, again, with CalAIM and the recognition that there could be some reimbursement across California, and I know other Medicaid plans are looking at other states, I think it's gaining a lot of visibility, and the linkages between the health system, the payer, and then the community partners providing the services.
Yeah, it's an area of elevated interest in the Feeding America food banking network, and has been for a little bit of time now, but it's becoming increasingly so. I have a question tied up here for Nolan that goes to this notion of aligning efforts, collective efforts, and it has to do with Nolan. I've heard you frequently speak about this notion of a shopping cart. It's a metaphor that you've been using pertaining to governmental versus charitable food assistance. Are these two sources of food assistance mutually exclusive in Yolo County?
Great question. This is one of my favorite topics, as you mentioned. I talk about this all the time. Ashley kind of queued me up on this earlier a little bit today, talking about sort of the, I guess, obscurity of having Medi-Cal and CalFresh issued in the same office, yet it's two different applications. It's, we make them two different appointments, two different benefit cards. Working in government social services for the last 16 years, you have all of these amazing programs that provide really unique benefits, but there's a ton of overlap. And what I mean by that specifically is CalFresh, you've got WIC, and you've got free and reduced lunch at school. Each of these programs in general is somehow funded through the USDA. So the money comes from the federal government, really from the same source, but has different staff, different requirements, different regulations. And then it rolls down to the county level, and we have a different application process, a different certification process, different card, different appointments. I mean, it's a lot of work to be underemployed sometimes, because you have to go through all these different appointments and things just to get these programs that you're looking for. And so just the obscurity first of having to apply for multiple programs, I want to kind of just put a pin in that and just really stress how archaic it sort of is that we make people jump through all these different hoops, sometimes literally in the same office, just two different doors with two different workers. And it's all because of these regulations that sort of overlap and kind of impede each other. So in Nolan's perfect world, you'd fill out one application, you'd get all the benefits, you'd go off on your way, you'd have a great day with your kids, and that would be the end of it, but we're not quite there. And so we're kind of working towards that aspect. There isn't a lot we can do to change the federal regs, but there are things we can do at the ground level to change the process the clients have to go through. So again, it's those coordinations, it's meetings, it's setting up your policy and procedure. So when you do your Medi-Cal application, you do your CalFresh as well. It's setting up partnerships with WIC. It's partnering with your local school districts and making sure you're sharing information, because chances are that family on free reduced lunch will probably qualify for CalFresh, and chances are they'll probably also qualify for WIC if they have kids under the age of 5, and vice versa. So the fact that we're not kind of cross-pollinating those three programs is sort of crazy making. So that's point one. The second point of that, and I think I touched on this maybe earlier in the conversation as well, government food assistance programs are not meant to be your primary source of food, right? So SNAP, the federal version of CalFresh, or the funding stream for CalFresh, is the supplemental nutrition assistance program, right? So keyword there is supplemental. It's not meant to meet all your needs. It's meant to kind of help you out a little bit. WIC, Women, Infant, and Children's, is really intended to assist. And I don't know if you guys have bought formula lately, but dear God, like, could anything be more expensive than formula and diapers, right? So it helps with formula, milk, and some fruits and veggies for young kids. And then obviously free and reduced lunch and free and reduced breakfast provide awesome, healthy, wholesome meals to different school districts. And there's a whole gatekeeping system there of, kids going through this application process and all these crazy things. And there's been so many advancements, specifically in Yolo County, where they just apply free and reduced lunch to the entire school, right? Which is great. So the point, though, is those three programs are not meant to solve all your needs. The free and reduced lunch helps the kids at lunch, right? WIC helps with your babies. And then CalFresh is a supplemental nutrition assistance program to help with some basics. You need things like the food bank, or you need other add-ons to really kind of round out your shopping cart. And so the vision I'd like you guys to have in your heads right now is some cute little family pushing a shopping cart down the hall. You've got your CalFresh, you've got your WIC, you've got your free and reduced lunch, and you've got your food bank services. And when you have all of those services sort of working together, you might have close to a full family budget for food, right? You're still gonna have to spend probably some of your disposable income, but really that gives you a pretty solid base. Any one of these programs on their own, though, is going to fail. It's not going to fulfill all your needs. So the shopping cart idea really is that we're the four wheels of that shopping cart, right? So it's the food bank working with the county for CalFresh. It's the county working with WIC for WIC services. It's the school district working with the four of us. So not only does this cute little family have this shopping cart full of these amazing resources, we have to work together as the wheels of that shopping cart to make sure that experience is as smooth as possible, as coordinated as possible, and as easy to access for those families as possible. They've got plenty of things to do, and we shouldn't be wasting their time with 4 different trips to 4 different spots for 4 different food sources. So really combining those as a package is what I'm sort of advocating for. And the more that local leaders, governments, and nonprofits can do that, the better.
Thanks for sharing that response with us, Nolan. Catherine, you produce such terrific, informative research to guide policy and execution of policy. I want to dive a little bit into that area. I was struck by this statement from your UC Davis webpage: the food we eat, the price it costs, the places we shop, and how we grow it all impact our health. how do those things do that?
Thank you. This is a super expansive question.
Yeah.
But it ties into big state and federal and even local policies around pesticide use, farm worker health, farm worker housing, protecting farm workers, immigration policy, who's growing our food, are they paid a living wage? I mean, it's, speaking of shocking things, the food insecurity in farm workers is higher than the national average, and those are the people that grow the food that everyone eats. It's not right. And then I hate to, that's where the food is grown, but then the how we distribute it piece, COVID has highlighted supply chain issues. Everyone can remember the toilet paper crisis early on, but we're still facing strangely empty shelves every once in a while because of centralized locations in processing and packaging. And again, essential workers who are crammed together and forced to take on more risk in terms of COVID exposure. So that I think that'll continue to be an issue. And then the last piece, the where we get it piece, there's been a big public policy focus on food deserts, which are neighborhoods that lack grocery stores. And the reason for that is again, systemic racism and classism in policy at all levels, which has deprived some communities of public funding as well as private funding. And that's not only grocery stores, but public transit dollars, school funding. Part of the problem with that conversation is that just because you live next to a grocery store doesn't mean you can afford to eat there. And so some of the policy discussion has perverted a focus on SNAP and WIC and food banks to getting food to people, and instead spent more time and effort on funding the development of grocery stores in underserved areas. But that gets back to a bigger piece of economic development. So I'm in my 30s. I plan to keep doing this for a long time. There's a lot to unravel in the food system in terms of how we're growing, distributing, and sharing in the bounty. And it's really heartening to see the update of Valley Vision's update of the food system action plan in partnership with the Sacramento Community Foundation, as well as all of the work that everyone's doing together here.
Yeah, the Valley Vision plan, I think, outlines a number of great next steps that I'm looking forward for all of us to take on in collaboration, as we've identified as a need. Let's see, we have a question here in the chat, and I think a good person to take this on would be Geneva and then Ashley. Question: can the panel talk about the relationship between the food system and the homelessness crisis in California? What are the complexities that community faces? And I mentioned Geneva because she has been dealing with food assistance for homeless individuals throughout the pandemic.
Mm-hmm. Thank you, Michael. Currently, I serve as the chair of our local Homeless and Poverty Action Coalition, which is a newly formed nonprofit organization. Noli mentioned it earlier. It's called HPAC, and HPAC brings together service providers that are working in the homelessness and housing systems to work on homelessness and housing issues. The newly formed nonprofit organization also has ex officio representatives from each cities. And of course, we have one from the county. So it is a collaborative group of people working on homelessness issue and housing. We do interact with the food system quite a bit. Referring back to the Project Room Key, as we were standing up Project Room Key, we realized that, we're asking all these people, our most vulnerable community members, to shelter in place. Most of our community members did not understand what was going on at the beginning of the pandemic. There had to be some extensive education regarding what was happening and what the health guidance was at that time. So what we were able to do was to bring in the food bank to provide meal boxes for each of our participants in Project Room Key. In addition to that, my organization in particular, this is where the grassroots movement come in, where as nonprofit organizations, we're more agile and we're able to really mobilize in moments of needs. So we were able to create a sign-up genius process where community members and companies could sign up for a particular day in order to bring warm food to our participants. What I've noticed in direct services in general is that although our homeless families do not have a place to prepare food, they still access food distribution. They're accessing food distribution for some of the non-perishable items. We try to put that aside for our homeless families. And they're also accessing food distribution. Sometimes they take it to, sometimes they're couch surfing. They'll take it to a friend's home to prepare a meal. Food is a basic need. We all want to eat well and healthy, and people have particular taste that they are used to when, culturally or just what they do in their lives, in their day-to-day lives. So the food system interacts quite a bit. I just think that everything is very connected in that way, where we're supporting the housing, our homeless families, and we're also supporting families that are also housed.
Thank you for that. Ashley, did you want to weigh in, since homeless services is the area that you're active in?
Yeah, I mean, I think we need to pause when we talk about the homelessness crisis and really say it's an affordable housing crisis. Like, we don't have housing. We have more resources serving those experiencing homelessness, and we're housing more people, but more people are becoming homeless than we can house. So if we actually stopped everyone from becoming homeless, you would see an improvement in the numbers of those experiencing homelessness. So I think, we have to change the framework and recognize that it truly is that there's not enough affordable housing. And California, I mean, we're seeing it so much every single day. Yes, there's Project Home Key. There's things popping up left and right. But I can't remember. I was trying to look it up, what the last numbers were about our shortage. But it's tremendous. There's a lot of federal funds that we're looking at, but it's a long road ahead. And then I think you add on to, for those who have a housing choice voucher that are lucky enough to find a place to actually accept the voucher, are usually in nutrition and secure places. So then you tie that to, okay, I'm moving in. Yes, I have a voucher, but I can't access food. I think, Catherine, you talked about transportation. I mean, all these things pile up when you talk about creating barriers and trying to help people, get to a place where they can manage, and they want to, but we haven't created a system that allows them to do that. So I think, all these things, and Jennifer, you talk about the poverty. That's at the core of what all this is focused on. But when you look at our solutions of where we're housing people, and we're not understanding the community in which we are housing them, that there's other needs that we need to look at, not just the housing piece. When we talk about, navigation support, social service support, nutrition support, all those have to be tied into it. And I think it's really important that we, unwrap the complexities and recognize, what are the key foundations that we need to make sure are in place when we talk about community-wide solutions. But I think, you take away the homelessness and you look about affordable housing, and then you look at where the affordable housing units are being developed. And there's a lot of work to try to make sure there are community components of that: safe parks, walkability, grocery stores that, Catherine, as your point, they can afford to go to. But it really is, needing to look at the bigger piece. But I think when you talk about the homelessness crisis, that puts the blame on the individual. We need to talk about that it's an affordability crisis that the system has created. And I'm not passionate about that or anything.
Those are great comments, and I love seeing that passion. I'm sure everybody else does too. So we've been focusing a lot of our our discussion at the individual level. I want to shift a little bit more to the community level, and I have a question teed up here for Katie. How does purchasing locally grown food, farmland conservation, and policies that benefit farm workers, the food insecure, and family farmers improve communities? So what's the impact on the communities?
I love this question because it takes the focus off of solving the problem and it celebrates all of the collaboration that went into working together, which is a really nice shift. Before I answer it though, I do want to build off of Ashley's point that it's an affordable housing issue. And for those who don't know, the way that it works in California is the state works with regional governments to set out how much affordable housing needs to be built for every city and county. And then city and counties plan to meet that affordable housing amount so that everyone's doing their fair share in their general plans. So there's a piece for everybody listening here to take back to their home jurisdiction and advocate for more affordable housing, because what often happens is people say, not in my community, we're built out. We don't have enough space. We can't rezone. Let's build that affordable housing somewhere else. And to Ashley's other point, it's really helpful where affordable housing can be co-located with good schools, parks, services. So there's a real need for communities to support each other on that, which will lead me right into Michael's next great question. So when I first started this research 6 or 7 years ago, we looked at Chester County on the East Coast, and there's a wonderful food bank, another wonderful food bank, Chester County Food Bank. Larry Walsh is the director there. And the food bank partners with all of these local farms and supplies a lot of local food and operates as kind of an incubator for smaller farms who are struggling to find land, struggling to get long-term contracts. And as part of that, the food bank, this integral piece in talking about local agriculture, preserving farmland, raising awareness about healthy food, gardens at schools, partnered with tens of schools, gardens at churches, raised bed programs. And so we did this crazy network map. We mapped all the places that food was grown and where it was then sold or donated to. And we did it in 2015 and we did it again in 2000. And, these are thousands of connections of food being grown and shared. And the thing that stayed the same over that 5-year period was the food bank was still the central hub. 5 years later was this the go-through for small farms, large farms, schools, churches. It was a quite literally a central hub in the community and a convening spot for not just talking about food insecurity, but talking about land use management. And it showed up, surprise, surprise, in the county general plan as a get involved in food security, value our agricultural lands, make sure we're doing compact development that gives folks, everybody of all income groups, amenities, support new farmers. It did all of those things in a really collaborative, very beautiful way. And Yolo Food Bank does the same, as we spoke about before, with elevating the growers that it works with, purchasing from local farms, and showcasing those farms as well at food distribution sites. And just to get back to Alana Stein's dissertation work, the clients notice, Durst Organic on those boxes, and they notice and they say, wow, this is great. I'm eating organic food, and I feel really good about this food that I'm getting. And the people who volunteer at the food distribution sites notice it as well. The Yolo Food Bank also has a central spot in the Davis Farmers Market. So the same work is happening here, and there's room to grow it.
I hope you all had an opportunity to watch the video that we showed towards the kickoff of this summit this morning. But in that video, we do celebrate the growers that support our work, as well as some of the other food donors. If you didn't have a chance to watch that, we've recorded it, and I would encourage you to watch that. It's only like a 5 or 8 minute video. It's well worth your time, and I find it pretty inspiring. In fact, I tear up every time I watch the thing. So that's why I didn't watch it this morning. I didn't want to start bawling and have red eyes the rest of the day. Yeah, Michael's not always such a hard case. He's got a soft spot as well. And we have a 15-minute warning going on here. There was something that you said, Catherine, that spurred a thought of mine, but now it's somehow escaped me, which is, I guess, due to all this gray hair that I have grown in my beard. What do we got going on here for another? I don't know, who wants to weigh in on this notion of because this has kind of been interwoven throughout the panel conversation, that to have a thriving community, you have to have thriving residents, right? You can't have a thriving community if you have residents who are struggling. And what I'm hearing from all of you is you can't have thriving residents if their basic needs aren't being met. That seems like fundamental to the whole notion of having a thriving community, is that all of the community members, one way or another, they need to have their basic needs met. Who wants to jump on that?
I mean, I could start us off really quick just with a couple points that we sort of talked about earlier. I think, again, in these kind of entry-level frontline kind of lower wage workforce positions, we're seeing a massive amount of vacancies. And so if you really want to grow local products, you want to manufacture locally, you want to have a really, robust and kind of amazing hospitality industry, we're starting to see the workforce split. And I think, there's all these talking heads on the news saying it's this or it's that, or people are lazy or that, but I just don't think any of that's the case. I think what we're seeing is just a pretty significant divide in the workforce and what the modern American worker will really tolerate. And I think to some degree, we have put the brunt of that responsibility on low wage workers' backs. And we have to look at the environment that employers are providing and that social services programs are providing. If we don't sort of adjust for inflation, if you will, or adjust for the scenario for many of the workers that we rely on for everything from our meat to our produce to a whole host of other items, we're getting to a breaking point. And I think that, to some degree, there's a million ways to shore that up, but I think it's a discussion about how do we improve employment conditions? How do we improve living conditions? How do we increase housing? How do we make sure food is a right? And all of those items above are creating sort of this perfect storm that is starting to impact major industries in California, major industries in Yolo County. And so at a certain point, when you can't operate some of your major businesses and it's impacting your, county's gross domestic product, that's a problem, and I think we need to look at that across the board. So it's the notion that folks are just lazy and staying home is not true. It's just, maybe some percentage of that is true, but the employer environment is changing dramatically, and COVID just poured gasoline on that change and accelerated it. And I think as a community, we have to look at this holistically, from farmers and growers, from businesses, from local governments, nonprofits. What do we want our community to look like? And how do we treat our workforce? And how do we make sure that there is a symbiotic relationship between all of those parties involved? And so I think, this is where we start that discussion. So I don't know, that kind of a big picture point, but I think we have to look at our local workforce and how we're enabling folks to be successful and take care of their families.
Thank you for that, Nolan. Ashley, you've unmuted yourself.
Yeah, I think, and kind of going from the high level down to the grassroots, is letting the community determine what their needs are. When you talk about a thriving community, what are the priorities? Because you're not going to be able to do everything at once. So listening to the community and saying, okay, if our top priority is bringing a grocery store in and this, let's focus there. Let's get everyone to coalesce and listen to what the community wants to do, because I think it empowers them to be the decision makers. It shows that people trust their decision-making process, and then they're invested in their community. And so when you talk about the thriving communities, yes, we need the resources to make sure we can actually follow through with what their needs are. But I think listening to them rather than us dictating what is a thriving community in each community, because it's going to look different based on what the community makeup is. But again, I think, and we've all kind of alluded to this in some way or another, letting the community's voice lead the work is going to be a critical piece when you talk about a thriving community, because they're invested. We're showing that they have the decision-making power, and it's not something that we're just pushing down and we want a cookie cutter thriving community in every community.
So I think you've actually raised a pretty challenging dilemma there, which is, yeah, listening to the community. But if you're one of these vulnerable essential workers that we've been talking about, where you're working all day long and then you're having to take care of your kids after work and deal with their homework, and I mean, your life is pretty crazy. Where do you have the forum or the opportunity to voice your concerns and your priorities? Where do you have the opportunity to communicate with the policymakers about the need that you require assistance with your basic needs? So, I think these American Rescue Plan workshops that the county had been hosting, and now I think some of the cities are starting to get into it. Some surveys, you can see who's participating in those workshops and the surveys. They're folks that are generally a little bit higher up the food chain than the folks who are struggling to meet their basic needs. So Jennifer, what's your thought on that?
This is always the dilemma. It is a very hard question to really try to piece apart, because like you said, Michael, you have someone that's already struggling, maybe working 2 or 3 jobs in order to afford rent in general. What I've realized is that, like everyone has been saying, the housing crisis is an affordability crisis, and most of our families will probably spend half or more of their paycheck in order to pay rent every month. So that does not really allow for a lot of free time. What I'm proposing is for us to really try to engage with families through the family resource centers. I think we do a really good job of this in Yolo County, where we have family resource centers. We have home visitation programs that are going directly into the home. And then we also have programs for our seniors that are engaging with seniors directly in their homes. We could try to access feedback through that process. And another unorthodox way of accessing feedback is our local community boards on Facebook. I know it can be a hot spot for a lot of disagreements. I'm actually on a couple of community discussion boards, but when you really piece apart some of those feedback, they are very valuable. People are experiencing things in real time. There are things within local communities that are not being addressed. And as policymakers, we have to figure out a way to really incorporate and be as inclusive as possible. One thing that I feel like there's not a lot of attention is not being given towards the whole childcare crisis. So if you want a thriving community, we need childcare. We need childcare, we need food, we need affordable housing. So in order to get people back to work, you need to provide childcare. And as policymakers, and Nolan said this earlier about government programs, the income guideline for a lot of these public programs are very, how do we say this? Are very, they're not conducive to a working family. They're very low. You have to be extremely on the lower end of things in order to be able to be eligible for this. So this is something that I've had in my mind for a long time. How do we advocate for the government, the federal government, to increase the federal poverty guidelines so some of that assistance can actually trickle down? I always look at our families, the families that we serve. It's not that they're not working. It's not that they don't intend to work. They're not lazy. That's the myth that's been circulating. People don't want to work. They're lazy. They're working 2 or 3 jobs. How can you be working at Walmart and still be on government assistance? It doesn't make sense. So if we really want the community to thrive, I agree with Ashley, we need to listen to them. We need to figure out different ways of engaging with them. If we're going to roll out a survey or have focus group, let's have it in the evening. Let's have it in multiple languages. Let's have it at the local church. Let's have it in the park with a barbecue. Invite the community to come out so that they can provide feedback. That was a long way. That was a long answer, but.
No, but that is a great response, and so I definitely appreciate it. And we're actually down on the wire here, and I want to express my deep gratitude to all of you for your passion, your work, and your interest in this subject, and your willingness to join us this afternoon to have this worthy conversation. So thank you so much for all that you do. This has been a real pleasure, and I'm looking forward to seeing you around, all of you around the county. Thank you so much, guys.
Thank you, Michael.
Yes, thank you for the thoughtful conversation.
Thank you.
And last word, lead with compassion.
Lead with compassion.
Lead with compassion.
Compassion and gratitude. That's
Yes.
what we lead with at the food bank. Yeah, compassion and gratitude.